and welcome. Thank you for those who have joined us today for our webinar. My name is Melissa Casanova, and I am our marketing manager and physician liaison here at VEI. We are really enjoying doing these webinars lately, and we just appreciate you taking out the time to spend a couple minutes with us. Please feel free to ask any questions throughout the presentations in the chat feature. And obviously the topic today is blepharoplasties, or upper and lower eyelid surgery. And we've got our two oculofacial plastic surgeons, Dr. Nicole Langelier and Dr. William Bearden joining us. Hello, and thank you for stepping out of the clinic today. That is a mouthful. Wow. This is very exciting for us and one of my favorite topics. So to start off, Dr. Langelier, if you don't mind, just introducing yourself and giving us a little bit about your background and what you specialize in. And again, just a quick note, this will be recorded and added to our websites and will be sent out to everybody's email. So if you missed the first portion or a couple minutes in the beginning, you'll be able to rewatch it. So.
Wonderful. Thanks for the intro, Melissa. We're excited to be here, and thank you guys for taking time over your lunchtime to join us. Dr. Bearden and I do oculofacial plastic surgery. So we are specialists in the eyes and the face. And so, you know, what's I think unique about our training is we're both board certified ophthalmologists. So we know all about your eyeballs. We know about dry eye and LASIK and glaucoma, macular degeneration. But we also spent a lot of time dedicated to plastic surgery of the face, specifically around the eyes and the upper face. So hundreds and hundreds and hundreds of surgeries and training. And then when we go to the operating room, I like to joke that all we do is lids, lids, lids. So we're working around your eyes with every case we do. So I'm going to share my screen so I can tell you a little bit about us, and we'll go from there. How's that sound, Will?
Yeah, that sums it up pretty well. I mean, what I tell patients is that, you know, what we do around the eyelids is our super duper so specialty. You know, we're not going to be doing, you know, bottoms and tummies and that sort of stuff, or butt lifts. And so we do face stuff and eyelid stuff, and that's kind of our specialty. So we really hone in on do you know, lots and lots and lots of that. So.
All right. So let's see if I can share my screen and if this goes well here. Okay. Melissa, can you see this?
I can. Yes.
Okay.
Good.
So, you know, it's really hard to talk about eyelid surgery without having some visuals. So we put together a little run of slides here that we'll go over to try to explain some things to everybody. And then at the end, there's certainly going to be time for Q&A. So first, as I had said before, what is an oculofacial plastic surgeon? We have a lot of training both in the eyes and in the eyelids. We went to school for 3 years after medical school, and there's actually only about 750 doctors in the world with this type of training. So this is sort of our condensed CV, and I joke that we went to school for a really long time. 26th grade is what we both graduated from. Please take note, there's a lot of our patient pictures in these presentations, and they very kindly allowed us to share them. So out of respect for privacy, please don't take screenshots. And then, of course, the typical disclaimer is that this is generalized information and is not considered personalized medical advice. So why do patients seek our help? There's a lot of different reasons, and people come in and say their eyelids are droopy, or heavy, saggy, puffy, hooded, baggy, have dark circles, make me look tired, make me look sad, make me look mad, I can't wear makeup anymore, my eyes look closed in pictures, and of course, sometimes they interfere with your ability to read, drive, and see peripherally. So what's the solution? And really, when you come to see Dr. Bearden or myself, the first thing we're going to do is try to figure out the cause of your problem. And I know that this presentation is titled Blepharoplasty, but there's really 4 main reasons why upper eyelids can be heavy, saggy, droopy, or puffy. And it's our job to help find out what they are, point those out to you, and talk about the various solutions. So we're going to actually walk through a little bit of that to hopefully help you understand a little bit more about your own facial features. So the first thing that can happen is you can have extra upper eyelid skin or fat. That's called dermatochalasis. And the treatment for that is a blepharoplasty, where we remove some of the skin and fat. And then these are some examples of before and after upper eyelid blepharoplasty. And the bottom says what surgery they had done. You can see in this picture here, she also had lower eyelid surgery. But all that was done here was removing the extra skin and puffy fat up above on the upper eyelids. And you can see that there's an improvement in the amount of hooding she has and in her appearance. Similarly here, this patient had heavy upper eyelids and heavy brows, and then this is after just upper eyelid surgery. And here we worked on her lower eyelids too, but those heavy upper eyelids and almost like a visor is that effect has now gone. The next thing that you might see in your eyelids is a little bit of something called ptosis. Do you want to talk about ptosis, Will?
Sure. So again, there's two big categories, well, more than two, but two really big categories why your lids are droopy. Either you got too much baggage weighing things down. We try to keep it simple here. Either too much baggage weighing things down, which Nicole just discussed, or there's a muscle within your eyelid which helps you open your eyes. And sometimes that muscle, for a variety of reasons, either doesn't work as well or just straight slips loose. And so that kind of allows the lid, or makes the lid kind of sit at half mast and hide some of the colored part of your eye, for lack of a better term. People notice that a lot. And we'll often hear from patients who have that kind of issue that in particular in the evenings is more challenging to read or drive than it used to be, just because the light's low, your window shade's halfway down, and the way you compensate out of it is, is your forehead, and you get tired after a while. Anyway, but that muscle is in its either placement or its function is the big thing about levator ptosis, and that's we call this. Is basically the difference here compared to these other patients is, not only does this guy have a lot of baggage up there, but the lids just sit low across his pupils. And so that's the difference. So, the ptosis thing is fixing the muscle, other one's fixing the baggage, what Nicole just discussed, or sometimes people need both. But here's an example of this gentleman. You can see how you see a lot more of the brown of his eyes afterwards. And that reflective light going through cleanly allows him to see better. Same thing here. You can see the distance between that reflection of light and her lids really small on the left side, and on the right side you see a lot more, obviously. And I think in her case, I don't think even skin was removed for her. This is just straight up treating the muscle. So you can see how the skin itself bunches up some of the right side, which some patients don't like that. A lot of them don't like that. So often we'll do that at the same time. If somebody's here to see better, they don't want that baggage up there either. We can deal with that at the same time, and we can talk more about that later. Here's more of the same. Again, just fixing the muscles, more blue showing on the right and the left. The skin bunches up a bit, not terribly so in this case. And these are often lumped together by folks who don't do a lot of eyelid surgery because they're in the same place, and we often borrow the same incision, but they really are different operations. And one of the reasons we insist people come in for a consultation is patients a lot of times feel like they have a good idea of what they need. They've done a lot of reading, which is great. We always encourage that, but they're often really surprised as to actually what they need to be done and why. And this sort of thing is better ciphered or deciphered in person. And so, a lot of these visits are kind of an education thing, and we steer you in the right direction as to what you need, no more, no less. Again, more of the same here. This gentleman here with the blue part's pretty hidden, on the right it's not. The next thing, you want to talk more about the eyebrows?
Sure. So I'm going to jump back in and talk about the third factor. So we talked about extra skin and fat treated with blepharoplasty. We talked about ptosis, or a saggy muscle, stretched out muscle that we tighten and open the eyes wider. Third is your eyebrow position. So our eyebrows are connected to our eyelids. And in fact, like Will said, when you have ptosis, those eyelids are half masked. We often find these patients have forehead wrinkles because they've been trying to stretch their eyes open so wide to see.
We actually have patients come in, just jump in for a second, who come to see us because they have horizontal forehead wrinkles. And we have to explain to them that it's because your lids are droopy. And they're like, and just connecting those two is really foreign to folks, but really that's what it is. So, okay.
And so eyebrow position is important because if the eyebrows, or even the full forehead, is heavy, it can make the eyelids look and feel heavy. And so there are a few different ways to treat that issue. The first thing to analyze is whether or not it should be done in the first place. Will and I both like our patients to look natural and not windblown. I don't want anyone to say, what kind of surgery did you have? I want people to say, gosh, you look so well rested. But it's important to remember that the eyebrow position and shape is different in men and women. And so we look at each person with their individual facial structure and their gender and what their desired goals are, to make sure that we're not taking a guy and lifting his brows, which can feminize.
Right.
Or women can often look angry if their brows are too low. You lift them up and people look happy again. So there's a lot of techniques, and it's important to talk with your surgeon about which technique, if any of them, are right for you.
Yeah, I mean, done well, this sort of work is not a cookie cutter sort of thing. That's one thing that's when we try to stress to our patients and to you, is that, you know, we really is tailored to what you need, no more, no less. And that's really, really key.
So on the left here is a patient before surgery, and she came in for heavy lids, and she certainly does have some extra skin on her lids, but really it's her whole forehead's heavy. And you can tell that that's the case because she has this horizontal wrinkle on her nose, and that's a wrinkle created from the heaviness of the forehead. So she actually underwent, it's not truly a brow lift, it's a forehead lift. You can very faintly see when she pulls her hair back, that scar here healing at 3 months, which is still in the healing phase. It's still red and continuing to fade. And but you can see the much larger change that happens with the eyes when the brows are lifted too.
And I would encourage everyone, if you can see the slideshow, we should have stressed this up front, but if you look at the post-op pictures, what I tell my patients all the time is, if you cover up the pre-op picture and you see these post-op pictures, it looks as if they've not had surgery, and which that's what we're shooting for. That's the natural appearances Nicole referenced. That's really, really important. And if you use your imagination, forget the pre-op pictures and you can't tell, that's good work. So.
And this is just walking through the recovery here. So this is what the patient looked like on day 1 with the stitches up in the brow and on the eyelid. Not a lot of pain. Typically Tylenol takes care of discomfort. A little numbness to be expected, and that improves with time for most patients. And then 3 months later, this is what she looks like. And zooming in on the incision line hidden here by the hair, the incision line is actually beveled in the front of the hair follicles to try to encourage hair growth to grow through. So she's still early in her healing phase, but what we're going to start seeing is some hairs starting to hopefully sprout through that scar because of the technique that was used. Here's another example where the only thing that was done was working on the brows. We haven't touched her eyelids, and she might benefit from working on the eyelids too, but at least she can see now, and she doesn't look like she's literally wearing a visor from her eyelids and brows drooping down. This is the placement of her incision. She's a redhead, so it's really beefy red at first. At 2.5 months, it's already fading, but you can see that this hides up here behind her hairline.
Will you back up 2 slides? Let me show you one thing that's really important. One thing I've noticed, I mention to patients all the time, this lady in particular, she looks like she's kind of scowling and is pulling her brows down. And so that's the way, this is not the topic today, but Botox helps that. You allow you to scowl less so your brows aren't pulled down. But there's also, for some patients who really scowl a lot, we can actually access that muscle and just remove the thing, kind of a permanent Botox effect to really, and that helps the brow position as well, which is what I brought this up. But the brows are really, really key. And part of the equation, a lot of patients don't really realize is part of it when they come in. So.
And another example using kind of the same approach, she didn't have her eyelids worked on at all. That was just lifting the forehead and kind of just giving her a refreshed appearance to her upper face. And then zooming in again, you can see her forehead wrinkles improve because she's not using her forehead to lift as much, and the surgery itself tightens the forehead skin a little bit. And then at 5 months, there's her scar healing. You can see some hairs starting to sprout through. She's really doing quite well. And this is a different technique to lift a brow. So, unfortunately, the prior technique isn't typically covered by insurance. This is a technique that if the brows are really heavy, it has to be what we call visually significant and meet certain criteria. But some patients have brows that are so heavy that the brows themselves are blocking the vision. And so in this case, this patient really wasn't able to see very well, and it was because of the heavy brows. And the brows have been lifted through an incision placed above the eyebrow hairs. You have to be really careful about somebody's eyebrow thickness and can we hide the scar? And that's a big discussion that we have with patients to see if this is a good technique for them. There are a lot of tips and tricks that we can do to try to make the scar heal as pretty as possible, but at the end of the day, it is still a little bit of a scar. So it's not something that we always recommend. And here's another example. And this worked out well because you can see the scar is hidden in this man's bushy brows. But you can see that the heaviness is improved. He may benefit from eyelid surgery as well, but you can see that there's been a dramatic improvement just by working on the brows.
Okay, so this is like a little video here of a guy who, this is afterwards, and hopefully, again, like I was saying, in the after shot, well, here's before, you can see the big bags in his lower lids. He's got pretty heavy brows. This is after. It looks like he hasn't had surgery, hopefully. And then here again, and this is important as far as, for some people, we can access the brows internally and elevate them some, not dramatically, but a small amount, but also sculpt them, make them look less and feel less heavy. But hopefully that before and after shows, hopefully this looks like he hasn't had surgery, which is our goal. So.
Yeah, and just to clarify, the reason you're not seeing a scar here is because all the work was done through the eyelid. That's called a Transblepharoplasty brow lift. And through the eyelid crease incision, actually, when Dr. Bearden was in training, he and his mentor pioneered this technique. But you're releasing some of the brow through that incision. And it's not so much of a giant lift, but to support and keep it from falling down. And it really makes a big difference for a lot of people.
For some patients, it's not powerful enough, but for most patients we see, it's about all they need. So it works pretty well for them. So.
And then, let's see. And here's another
patient who similarly, this is more before and after. We worked her upper and lower eyelids, but important thing up where we added this is because her brow fat pads, which is not really the eyelid, but the actual brow area above there, is just bulky and heavy. So part of eyelid surgery sometimes is debulking that and making it less heavy looking, just lightens the whole thing. And also in doing that, you also there's a preventive aspect to that too, because you're always slowing down forehead descent, which we're always sadly having to battle as we age. But again, you can see here, hopefully afterwards, she looks like she hasn't had surgery, but she looks nice and natural.
Want to talk about the brain?
Sure. And basically, when you have one eye that's droopy in particular, the way your brain works, without getting too detailed, is that it works hard to get especially your dominant eye open. And so we'll see a lot of folks come in and say, I got a droopy lid, doc. And then I have to explain to them, like, well, you're right. That one is, but so is the other one. And let me show you why. We show how if we lift one eye, the other one falls. And also for some folks who have heavy lids in general, their tendency to hike their forehead up to help kind of to compensate that, when you get rid of some of that, well, this shows it perfectly right here. You can see how with some of that, in this case, when you lift it, tighten her muscles, to help her see better, the later ptosis thing I mentioned, she kind of relaxed her forehead some as well. So there's a lot of moving parts here. And that's why, again, seeing someone who does this all the time, who does lots of eyelids, is in your benefit, because some of these nuances are going to be lost in a lot of folks. And
so in this case, this patient had her muscle tightened to open the eyes wider, and quite a bit of extra skin was removed in a cosmetic blepharoplasty as well. But it looks like, wow, there's still not a lot of place for makeup here. And you can see that before she was lifting her brows up so high, but now that her brain doesn't have to work hard to see, she's not having to use her forehead to lift her eyelids open. They're just nice and open. She doesn't have to work hard. Boom, those brows come down, and that heaviness then manifests. So it's just something that we always like to think about and discuss ahead of time.
And notice in the first picture, it's kind of cut off there, but you can see how she has some horizontal wrinkles up there that afterwards are not there. And that's because that's what I was mentioning before about some people come in for forehead wrinkles when it's their eyelids, which is, again, hard to explain to folks.
And then this is an example of asymmetry. So you can see it's the screen left, but patient's right with the red arrow. Before droopy eyelid surgery, that right brow is higher. And so I've had patients come in and say, I want you to fix my uneven brows, but they have ptosis. And so I say, we might need to do this in 2 steps. I really can't work on your brows at the same time as your eyelids, because I think your brows are going to change after eyelid surgery. So let's fix the droopy eyelids and see what happens to your brows. And then you may or may not even need brow surgery. And you can see that her brows evened up quite nicely after surgery. And this is another example.
Yeah, this is someone who, and in her situation, we kind of make you relax now. So this is someone whose left brow sits over the right, obviously, and who, to maximize her symmetry in conjunction with her surgery, I was able to lift her left brow to match the height of the right. That's one of the things that Nicole mentioned as far as working through the blepharoplasty incision to kind of do some brow elevation. And it's tricky sometimes because, like Nicole just said, sometimes that can be because the brow is droopier, or it can be because they're trying to hike one brow. And in this case, I was able to get a relaxed one up to know that actually was lower as well. So, but again, these are nuances that unless you do a lot of eyelids, it's kind of hard to pick up on.
So then aftercare, we actually have a great video on YouTube, what to expect after eyelid surgery, but this is sort of a summary. So aftercare instructions vary by surgeon and by surgery and by person to person. But in general, discomfort is minimal to moderate depending on the surgery, and usually people do well with just Tylenol. Blurry vision is really to be expected for at least a week because the ointment we have you using to help you heal is greasy and blurs the vision. It's made for the eyes, it won't hurt your eyes, but it's just a little annoying. It's a little greasy. Really important not to do anything strenuous for 1 week. No exercise, bending over, don't lift more than a gallon of milk, no yoga, no golf. And that's because we've just worked on really delicate tissues around your eyes, including some blood vessels. And we're really careful to control any bleeding in surgery, but we don't want you to go home, strain, and pop a blood vessel and run into a bleeding problem, which lightning strike rare. Dr. Bearden and I have not had anybody go blind from bleeding, but we don't want any of our patients to be the first one.
Right.
So that's why I'm just so strict about this instruction.
Yeah, that's something we have to discuss with every patient we see, is that that's always out there as a risk, but we mitigate it by doing all these things that Nicole's talking about. And a really important point here, I feel like, and we hear this all the time from our folks, that, you know, they're surprised how little it hurts or how little discomfort there is, or that they didn't use their pain medications. And the truth of the matter is, though, if you do a lot of eyelid surgery like we do, it's such a familiar area. And if you don't do a lot, it's not as familiar. But if you're able to respect like your natural tissue planes, the anatomy, and use it to your advantage and not just blast through everything, you know, big surprise, it doesn't hurt as much, right? And so we hear that all the time from folks. We never promise pain-free surgery, but people are always shocked how little it hurts. So.
And then, you know, when we do the surgery, we're really careful with how we use the local anesthetic, which numbs you. Too much local anesthetic makes your eyelids really swollen and hard to see the forest for the trees when we're operating. But just the right amount lets us do the surgery and keep you really comfortable. And it takes a while for that to wear off. So by the time you wake up, get settled, your eyelids are settled, and the numbing medicine wears off, you're in a pretty good position typically. But we always say, you know, if it's more than a little discomfort, I don't want you sitting home and suffering in silence. Please call us, because too much pain can be a sign that something is wrong. And we never want you to sit at home and suck it up. Definitely let us know so that we can make sure everything's okay. So other things, you know, to control bruising and swelling, it's important to use ice or compression goggles for the first 2 to 3 days after surgery. So after surgery, you know, you have some bruising setting in. Believe it or not, compression works better than ice to reduce bruising and swelling. And so there are these goggles that have been designed just for eyelid surgery. There's ski goggles with foam. You can't see through them, but they work much better than ice to reduce your bruising and swelling after surgery. It's like if you sprain your ankle and you wear an ACE bandage around it, you're going to have less swelling than if you just let it open and let all the fluid pool in that area. Ice only reduces blood flow to the area generally, but it doesn't stop all that leaking that's happening through in the surgery site. And then we have you sleep with those goggles for 2 weeks or wear eye shields over your eyes for 2 weeks. And that's because we don't want you to accidentally reach up and rub your stitches and break them, but also the goggles will help you heal while you sleep, because when you wake up, you won't be swollen like you would be if you had just been sleeping without any eye protection on. We have you follow up in 1 day to 1 week. It really just depends on the surgery. Different antibiotic products, ointments, drops, sometimes even oral antibiotics, depending on the surgery. Bruising takes about 2 weeks to resolve, but really varies person to person. And then people always say, like, what's the downtime? When can I go back to work? And it does a little bit depend on your comfort level. So people who don't mind looking a little bruised, a little beat up, and can hide behind glasses and have a desk job, I say it'd probably be fine to go back in 2 days, but take a week if you want to. I think that's very reasonable. And then other people who work in the public really can't look like anything happened. I say, you know, you really want to give yourself at least 2 weeks. And I usually advise no special events for 4 weeks after surgery, just to let like the little bits of swelling and just little things settle a little bit more. What do you think?
Yeah, well, the timing of aftercare. So there's two, people always ask, you know, what's the downtime? To me, downtime, there's downtime of what we think is safe, and there's downtime of what the patient thinks is they look okay, right? And so from a safety standpoint, after a week, you can do what you want. I mean, I tell patients they run a marathon for a week if they really want to. So you can go for it. There's a gradual run up to that. But at 1 week, you'll still look as if you've had surgery. And I'll tell people, usually at 2 weeks, people, if they're up to wear, if they wear makeup, can wear makeup and pretty much hide most of the stuff. I'm not going to promise 100%, Obviously, if you're getting wedding photos taken, I'd wait a bit longer. But in general, people are pretty presentable at 2 weeks.
And a little example of this is one of my patients who bruised more than the average bear, and I use it to show that the bruising can follow gravity and go into the lower lid. So you see that 7 days after surgery follow-up picture where she has all the pretty colors. So that's what it can look like. These are 6 different people who had upper eyelid blepharoplasty at their 1 week follow-up, and you can see everybody's bruising really varies, but they all used ice. This is a patient who used the goggles, and I think this is really representative of the goggles experience. You just get so much less bruising and swelling.
Yeah, those have been a big, though I guess we've been using those for maybe 4 years now.
Yeah.
And I practiced a while before those were a thing, and they really are remarkable on how much they help, and just they're more comfortable, they're less hassle too. People just really like those a lot. So I'm really happy with those.
So that's it for upper lids, and we can take questions now, or we can shift gears and start talking about lower eyelid surgery, because we do have a little talk planned for you about that too. What do you think, Melissa? What should we do?
Well, we don't have any questions yet, but if anybody has any questions, feel free to type it in the chat.
Yeah, chime in, or you can send a message right through Zoom. The moderator, great.
Can you hear us both okay, Melissa?
Yes, those sound great.
I'm not known for my loud talking.
No, you sound great. I say move forward.
All right, we'll press on. So that was a really good talk about the upper eyelids, and there's a lot of nuance and a lot of interesting things to talk about. Lower eyelids are similar in some ways, different in some ways, but we'll dive in here. So first of all, we hear people talk about their lower eyelids, and what they call it, what people call it, it'd be called by 100 different names. The dark circles, the bags, the droopy eyelids. So a lot of different names. But basically, what I see when we see people who have heavy lower eyelids or baggy lower eyelids is they can look hollow, they can look full, they can look tired, all those sort of things. And there's a lot of different reasons why that's happening. And so we're going to kind of dive into specifics as to what's really going on, and how there's 3 big categories, 3.5, 4, but not everyone has all those problems or needs those problems addressed. We're really trying to tailor to what you need. And so, and no more, no less, because the less we can do to make you happy, the happier you're going to be. So, so next year, so first of all, just straight up bags, right? So the bags people see, and they're often accompanied by dark circles beneath, which is more of a shadow effect. We'll get into it in a bit, but the bags themselves is,
It'll show here.
Yeah. Okay. So the bags themselves are simply just fat pushing forward. We all have fat around our eyeballs. There's a little membrane that kind of keeps that back behind our eyes. And over time, that kind of stretches. And so the window kind of bows forward like when in a sail, like a spinnaker sail is what I tell people. And so that's what you're seeing there. But you can also see beneath that pooching fat, there's a membrane down there. It kind of holds it back. And so you end up with a valley there. And that's what really it leads to the darkened circles. And a lot of times those dark circles aren't really dark skin. It's just straight up shadow contour, like a valley. And we'll talk more about that. So anything else you want to say there?
No.
All right. As far as the way to address, lower lids and bags, sometimes patients can just have the valley filled in with filler, and some people that's not going to work that well. It's more the bags or the pooching fat, and some people they can go either way. We kind of talk through what the ins and outs are, different approaches, and good, bad, and indifferent as far as longevity of the treatment and what's involved in downtime and all those sort of things. So that's the thing we talk about in a consultation. But the bottom line is, people ask all the time, there's not really a good way or safe way that melts that fat. Maybe there will be one day, but right now there's not. And so you can see here an example of someone who's had some of the bag removed down there and some of the skin tightened as well. And that's another thing. That's the 3 big categories of things are fat pushing forward, hollowness, and then the kind of crepey wrinkling of the skin. And they're all addressed by different things. And you can see in this patient, she had all 3. She had the lower lids with the fat pushing forward. She was hollow, but she also had the crepey skin we dealt with the laser resurfacing down there.
And just to touch on one thing the slide says, and like Will said, right now, there's really no safe options out there to melt the fat away with an injectable. It really, it's a matter of removing or repositioning the fat surgically, or sometimes we use filler injections to camouflage the bags. And we're never melting fat with the filler. You're simply filling up the hollow space and often the lack of volume in the cheek to make the puffiness of the eye look less pronounced. And it doesn't work for everybody. It's not good for severe cases, but it is an option for some people.
Yeah, that's a great point. Some people misunderstand what the filler actually does, for sure.
So I just wanted to touch on this little point here. So another thing that people point to is not the bags, but the cuff of puffiness they see under their lashes, especially pronounced when they smile. We call this colloquially the Orbicularis jelly roll. And what that is, just what I like to educate my patients, in my opinion, this is muscle. This is skin, but right underneath it, vital muscle that holds our eyelid up, pumps the oil out of our oil glands to keep us from getting styes, and helps to pump the tears that we make down the tear drain so we don't get a watery eye. So some patients, like the one at the bottom who had a lower lid blepharoplasty, might say, well, I still have this puffiness under my lashes. And I say, great, that's your normal healthy muscle. We're going to leave it there. I'm not cutting that out of you. If it's really pronounced, a tiny little touch of Botox can calm it down. But I've seen some pretty awful complications when people too aggressively try to treat that area because that muscle is really vital. So that's just my own little conservative pearl as an oculoplastic surgeon, but also somebody who really looks carefully at the eyes. That muscle has a purpose. So we don't want to chase beauty too fast.
I totally agree. And patients ask me that all the time. And what I tell them, it's really the truth. You notice, it really has the jelly roll kids.
Mm-hmm.
It's very
it's
useful. If you see younger people, especially kids, they really have that in spades. So I think when you explain to people, that's kind of a youthful sort of thing. Getting rid of that, I don't think serves people well in general. I think that's a great point.
Mm-hmm. And then finally, festoons. This is the other puffy part of the eyelid that people talk about. So these are tricky. This is loose skin and muscle, and it sometimes gets worse with fluid because it's a potential space where when we have too much salty or starchy foods, fluid can collect. And what it really is, if you look at the little drawings that have been put on these patients' faces, there's two ligaments in the lower eyelid, and the area between those two ligaments is where loose skin and muscle kind of folds together. And it's tricky to fix. I tell people, the true fix for this is a facelift with fat grafting. It's really caused because of loose ligaments, and it's not eyelid bags. It's caused by the bones changing as we age and different health factors. In my hands, I recommend sometimes some skin tightening or laser resurfacing, or if the eyelids themselves are saggy, tightening up the eyelids. But it is something that I really want people to understand is not removed specifically when you remove eyelid fat, because there's no fat there to remove.
I mean, that's a bugaboo. You talk to any surgeon, and any specialty does cosmetic surgery. Mm-hmm. And by the way, we didn't say this, but the lower eyelid surgery we're discussing, the bags, this is always cosmetic stuff, obviously. But anybody who does this kind of work will tell you the festoons is a real bugaboo for surgeons, because the truth matters, it's swelling, it's fluid. So surgery creates more fluid. So, you get back to where you were, but if anything, surgery will make things a little worse temporarily. So we really try to do things to artfully dance around them, either by, like Nicole said, tightening the skin over them, or esthetician has a device where you can kind of work on those with microneedling that can help them some. There's not one great home run treatment. So it's a hodgepodge of things without a great solution. So we kind of listed these here, things we can do to make those better. And Nicole mentioned the facelifting, to tighten the lower lid, sometimes remove some skin carefully. And another way to kind of address it, I think that works well is, we're going to talk more about fat transfer, fat transposition, where we shift tissue fat from the lower lid into where you're hollow on the top of your cheek. We'll get into this. But I found that even though it's not really addressing the festoon, putting more, if you can envision putting more volume adjacent to it, it just blends it in more. Mm-hmm. It doesn't stand out quite as much. So it's kind of a camouflage or masquerade for the festoon.
Yeah.
So this guy, we saw him earlier, but I point him out here too, because he's got, in his pre-op photos, he has some festooning out here. It's not severe as the last patient, but he has some out there. And you can see how giving him volume in his cheek adjacent just kind of hides it a bit. And this guy also, he's got that trough, but beneath, did they see our cursor? Yeah, that's a good idea. So you can see beneath this trough of the fat pushing forward. Does it keep going?
Yeah, press play again.
I'm going to pause it. I'm going to pause it here. So here.
Yeah.
Oh, shoot.
I can help you here.
Thank you. Perfect. So you can see here before surgery, he's got fat pushing forward here, and he's got this hollow trough here and this festoon right here. So what we did for him is we hide the incision inside the lower eyelid, which is important, what we haven't brought up yet, which is so routine for us. We don't think about it, but that's really something that our especially really emphasizes more than most. But we hide the incision inside the lower eyelid, so it's scarless, which is kind of cool. But we remove some of this fat pushing forward, but we also save some of it and tuck it deep to fill in the face where it's hollow down there. So we're shifting the volume down where you want it. So that really works well. It gives you a smooth contour. It just makes it look natural. So we both do a fair amount of that. And that's something that really works well for hiding that trough and the hollowing. So.
And then, we touched upon dark circles, and I won't belabor the point, but oftentimes the dark circles are shadowing, but sometimes it's not. And so what we'll do is tuck the fat back, put the skin on stretch, and actually look at your skin. We have a device as well that we'll use to measure your skin if needed, that measures the amount of melanin or true pigmentation in the skin. But sometimes it's your normal skin and it's all bunched up. So we need to tighten it so that it's stretched back out so it doesn't look so dark. Sometimes it's iron deposits. So patients who have a lot of allergy symptoms or get a lot of swelling, the skin is right on top of, it's paper thin, and it's right on top of this bright red muscle that gets lots of blood flow. So you can actually have iron deposits in there. And then similarly, sometimes that area looks black and blue because you are seeing that bright red muscle underneath your paper thin eyelid skin. And that makes it tend to look black and blue, just like blood under skin looks when you get a bruise. So, there's many factors, and I think that shadows are the biggest one. And usually dark circles improve when we treat the bulging and the shadowing effect with surgery. But sometimes there are other factors, and that's where skincare creams can come in handy. I've yet to find one that works well on puffiness. Sure, things with caffeine might vasoconstrict a little bit and make things less puffy. Cooling effects might decrease blood flow and decrease puffiness. But really, creams are great for hydrating wrinkles. And with the proper active ingredients can be used to help lighten some of the pigmentation.
Right.
So we kind of touched upon the options here for treatment of dark circles. You can see this before and after in this patient. The shadow effect is gone, and so her under eyes look a lot brighter.
And just notice this. This is really key here. You have this trough here. It's a valley. And so if you took a flash picture here, it would hide this. And but with a no flash, you see the valley. So you can see here with this patient, she has this volume now filling in, because your cheek deflates over time, right? And so you get this empty area here. So the volume is now replaced there. And plus you've sculpted above it. So it's a nice smooth contour. So light hits it as it should. And so that interface there with the cheek eyelid interface is really important. And that cheek deflation causes this hollow valley thing. But anyway, this is a great example. Somebody's had the fat tucked in there to really efface that hollow area. So.
And then I think, so then we just have a number of before and after photos.
Yeah.
So this patient, this sort of just summarizes everything that we talked about with upper and lower eyelids. So this patient has ptosis. So she has a stretched out upper eyelid muscle. She has a little bit of extra eyelid skin. She has some droopiness to her brows too. Those weren't addressed in the surgery. And then under the eyes, she kind of felt like she looked tired and had those dark circles. So now on the right side after surgery, her eyes, you can see those bright green eyes. And she still has not a lot of space for makeup, but you can see that she's able to wear makeup. And just her eyes look bright. She looks happy and well rested. And I think that's the key here. She doesn't look like she had surgery. She looks like herself, just like she went on a great vacation. Right. And I tell patients all the time, if you don't want people to think you had surgery, change something else about your appearance at the same time. Get a different haircut, color your hair, change your wardrobe. People aren't like, something looks different about you. And you're like, oh yeah, I got my hair cut. Because they can't put their finger on it often. You just look right. Healthier and refreshed.
And that's just a sign of, that's a sign of good surgery.
Yep.
Basically. Yeah. So,
and here's a side view.
Yeah. So this is a great side shot. The same deal with the hollowness. This lady has fat bulging forward here. Backwards, thank you. And But if you see her cheek here, and this happens to everyone as you age, the cheek kind of deflates here. She's got this hollow area, a little bit of concavity or flatness right here. In the straight edge shot, that's what looks like a dark circle. So here after surgery, you can see how the fat sculpted here, but now she's got a little bit of she's a little bit more full and convex here. It's not sunken and flat. So we shift the volume to the top of her cheek, sculpted it here, so it all blends together. So it looks like it's a nice natural, like she hasn't had surgery. And of course, she had her upper eyelids done as well. But that's a great shot of where we shift the volume again from here into the top of the cheek where it ought to be. It looks great.
And then this is an example of just lower eyelid surgery. In fact, in this patient, the bags weren't moved around. They were just straight up removed. And so you can really see here, well, that there's a nasal and a central fat pad. There's a dense ligament in the eyelid that we work with, and then another lateral fat pad here. So in her case, the 3 fat pads were removed and the skin was lasered. And this is about a month later. But you can see that, the bags are gone.
Here's another little movie about someone who's younger, has great skin. Like I mentioned, there's 3 big categories of the skin, the fat, and the hollowness. Her skin's great, but you can see here, I'm going to pause it here if I know how to. I'll pause and get back there.
Here.
I'm trying to pause it at the pre, but there we go. All right, so you can see here, so she's got fat pushing forward here. It looks kind of dark. This is the flash shot, which actually, like I say, kind of hides the hollowness, but you still see how her cheek's flat and this is kind of just deflated right here. This is a chronic allergy patient, a lot of eye rubbing. So she gets the fat pushing forward, but you can see how tired she looks, but she's so hollow in there. Her cheeks are deflated. But again, this is what we did for surgery. Again, hit the incision inside the eyelid, sculpted the fat that's pushing forward, but saved a fair amount and tucked it deep to fill in a face where it's hollow. And you can see it kind of shift down in the movie here, how that volume is now where it ought to be down there. So it gives her a nice smooth contour. And hopefully on the after here, hopefully she looks like
I'll help you.
I keep on doing the very end. In the after one, it looks like she hasn't had surgery, which is kind of her goal there, like that. That's what we're shooting for. So, and that's what they do.
Just more examples of refreshing the upper eyelids and the lower eyelids. And then this one shows a healing story. So to the left is the before picture. Her eyes were opened wider with Ptosis surgery. The skin was sculpted with a Blepharoplasty up top. The lower eyelid fat was removed and sculpted with Blepharoplasty through the inside of the eyelid. So again, no scar. And then the skin was lasered to tighten. And so we have our patients who have this surgery on the lower lids come back at day 1. I would say, I want to make sure everything is still in the same place I left it. So you come back in day 1 so I can check you out, make sure you're doing all the instructions right. And then again at 1 week, and you can just see the change in the healing, how much healing has occurred in that time. And then this is an example of a lower eyelid blepharoplasty in a patient with skin of color. And no laser was done for this patient because with her skin tone, there's a concern for causing further darkening of the skin called hyperpigmentation. But you can see that the bags are gone and that she has a much more bright-eyed look. And then this is a patient who came to see us that had been to multiple other doctors, and she was told that her eyelids were already pulled down too far and couldn't have eyelid surgery. But this is where the technique that Dr. Bearden's mentioned of moving fat around is really important. Yes, if we just removed the fat under her eyes, she would further lose the support to her eyelid. But instead, we preserved all that fat and just moved it further down into the hollow spot so that her eyelid still is supported. And in fact, what we get is the bags and the hollows are gone, and she has this nice contour from her eyelid down to her cheek, and her eyelid is supported, and she had no increase in dry eye, and she's doing great. And then this is just a montage of day 1 after surgery. I tell people if it's really crusty, like the patient in the top left, you need to clean your laser resurfacing a little bit better. The patient, everybody else on there is doing pretty well, but just a little longer of a vinegar water soak will help that problem. And then you can see the transition just globally and how much people have healed at this 1 week follow-up. So aftercare we touched upon, similar to upper eyelid surgery, but we also have you use antibiotic drops, oral antibiotics and steroids to help you heal. And the laser, think about it like an open wound, except there's no bandage. Your bandage is Vaseline, and then you're going to clean it with a dilute vinegar water wash where you soak for about 5 minutes to eat through the Vaseline, kill any bacteria, wipe it off and put new Vaseline on, and then ice. And like we had mentioned, checking up 1 day after surgery is important. So that's it. And we'll turn it over to questions.
Yeah, so quite a few. Do you want me to read them off, Dr. Langelier, or do you guys want to?
Yes, please.
Okay, so the first question, costs involved with upper and lower surgery. How to go over that.
What we tell folks, I mean, until we take a look at you and just like we just saw and see precisely what you need done, it's hard to really give you a cost because it varies. And that's, we kind of offer what you need, no more, no less. Sometimes that's more for some folks, sometimes it's less for some folks, what they actually need to achieve their goal. So without looking at you, it's really hard to give you a price. But we encourage you to come in and meet us. You know, the way this usually works, people come in, there's a cosmetic consult, there's a fee for that, but that goes towards whatever you do. So that's out to be zero. So we encourage you to come in and just talk it over with us.
And if there's a medical complaint, sometimes that visit is even billed to your insurance. And the other reason it's really hard to say it costs, $4 is because it depends on if we're doing something medical at the same time or if it's all cosmetic. It depends on if we're doing uppers and lowers, laser. Sometimes people come in, want surgery, and I say, you know what, you need Botox and a little filler under your eyes. Congratulations, you just avoided our operating room. And it's really hard to say, but gosh, off the cuff for one upper eyelid, depending on what we do, it could be around 1,500, and then it can be like 20,000, depending on how much you're doing. But I think that is a huge range and doesn't answer your question. And like Will said, the best thing to do is just come in, meet us. We hope to educate you on what your options are and help you understand what the safe and effective choices could be for you.
And I think we both have the same approaches. So when I see a patient, especially if there's a fork in the road where they can do this or that, and there's not really one definite way to go, we really just try to lay out your options and educate you and let you make a decision. So we have a lot of patients we talk to and say, hey, just come and think this through and let us know what you want to do. We're not here to hard press you what to do. We're not going to sell you on something, but we really both are big on education and allowing patients to think about it and decide what they want to do. And I tell patients all the time, we cover a lot in the first visit, and we just encourage you to come back in. If you have any questions, it's important that you feel good about what you're doing or not doing, so everyone proceeds confidently. So, but again, that discussion is really key.
Yep. The more information you have, the better choices you can make. And then I'm just looking along here. There's a number of questions about the goggles. So not everybody wants the goggles, so we don't include them in the cost. They're about $150. And whether or not people can use them if they're claustrophobic. So
Great question.
Great question, and defer to you.
Yeah.
So they are blackout. Generally, if you are really claustrophobic, we would not recommend them. The other thing is if you wear a very large CPAP machine, take a look at them. We have a sample that you can touch and play with. We can put, a tissue on top. You can try them on. But the idea is that it may interfere with how you wear your CPAP at night. So we need to take a look at that too. But if you're tremendously claustrophobic, you may not like them. Now, they're as easy to take off as just lifting them off too. So, and it's not, and I always tell people too, your final result down the road is the same. These just help get you there quicker.
Right. Yeah, the endpoint's the same. I see a great question about the cataract surgery first. That's a really good question. And it really depends on if you're looking to have the kind of cataract surgery, which in the last 10 years has come about, that fixes astigmatism, or one of the lenses that kind of changes where you don't have to wear glasses as far as astigmatism and replace glasses in that fashion. Sometimes when you do eyelid surgery and you lift a really, not all, but occasionally a very heavy lid off the cornea or off the eye, it actually changes the astigmatism a little bit, which can shift what kind of lens you might need. So what I tell patients is that if you're looking to have what I call a fancy lens, then I think doing eyelid surgery first makes the most sense. And because we don't want you to have your fancy lens put in and then do eyelid surgery, and then you have to go back and get your refraction touched up. So I'm using some fancy words, but basically the bottom line is, I think that the best bet is to come talk to someone, And I think using the eyelid surgery first makes the most sense so that you know exactly, you don't have to have any guessing going on if you have your cataract surgery.
Yeah, and I apologize. And this comes back to the ophthalmology training. We're used to these fancy words. I'm like, oh, refractive astigmatism from,
I know.
But the idea is that our eyeball is like an inflated balloon, and our eyelid puts a certain amount of pressure on it. What we see, what our glasses prescription is dependent on mostly on the shape of the cornea in the front of the eye. How round or flat is the eye? And the eyelid, putting pressure on the eyelid, can make the cornea change shape subtly. And that subtly changes your glasses prescription. So even with surgery, I tell some of my ptosis patients in particular, don't go get new glasses until 3 months after surgery, because when I do this surgery, it could ever so slightly, in some patients, not all, change your glasses prescription. So, and same goes with cataract surgery. It's really safe to do it before or after. And the old adage was, do the lids first, because cataract surgery could make your eyelids droopy again. Turns out that's not actually the cataract surgery. It's more all the steroid drops after. And it's not even, it's still not the most common thing. Most people don't get a droopy eyelid after cataract surgery. But we want to make sure that you get the best lens in your eye, and then we can work around it with your lids. I hope that answers the question.
Right. Yeah, exactly. And so, I mean, and what I was describing as far as the lid change the shape of the eye, that's not common. Doesn't usually happen, but it can. Yeah. And so if that's the case, you want to have not done anything permanent with the lens beforehand. So that's what we get. So,
anesthesia, laser resurfacing, and
the laser resurfacing actually is not always necessary. And that's what, again, seeing you in person and talking these through, some people have that crepey wrinkling that it's a home run for. Some people don't even have that. Like we showed you that one patient, a younger patient, we didn't touch rip laser. That's just shifting the fat around. But it just depends on what you need. So the answer to your question is no, not everyone needs that. And as far as having iritis and treating this, I think it's fine if you have iritis as a history, it should be quiet. And certainly there's some things we can do to kind of, and by the way, again, fancy words, iritis is inflammation in the eyeball that some patient gets. It's kind of a disease sort of thing. But even if you have that, if it's quiet, we can do eyelid surgery, but we might take some extra precautions. That's a great question.
We might have you take a little bit more steroid than we would otherwise to keep inflammation under control. We might need to follow you a little bit more closely, things like that. And then some patients with iritis might be on immune suppressing medicines. And so that's the other thing we look at in your history too. Like, what are all the medicines you're on? How could this affect your surgery? But generally speaking, if you have iritis, it's not a reason why you can't do eyelid surgery. And there's a lot of things that people think, oh gosh, I have glaucoma, I can't have surgery, or macular degeneration. It's not true whatsoever. We just need to take a really careful look at you and know about your eye history and talk to you about it.
As far as the anesthesia used, the next question, that's a great question. And it really varies to what you're doing. I mean, we do some things we just do in the office. We have an OR suite here, I do local anesthesia, where you're pretty awake, we're talking to you, depending on the person, they can tolerate that. All the way to some people need to be asleep for some of the surgeries, depending on what they're doing. So it really varies widely as far as what you're doing. But again, this is an example of tailoring it to what the patient needs, no more, no less. Because some patients need certain things, some don't need others. And we really try to, our goal is always to be as least invasive as possible and done. And so that's a great example of that. And
to talk about your individual goals, I could be doing the same surgery on 2 different people. And one person looks at me and says, Doc, knock me out. I don't want to know a thing that's happening. And the other person says, I'm afraid to go to sleep. I want to be awake. I want to know what's going on. So it really is a conversation that we have with each patient. And I will say about our anesthesia and where we operate. So I do 99.9% of my surgery at our surgery center, which is over by University of Richmond, Huguenot Bridge area. And we work with the same anesthesia team day in, day out, and they're fabulous. And they really are experts in the type of anesthesia we need, because sometimes I want you sleepy, but then I want to wake you up and I need you to open your eyes so I can check my work and get things just such, and then let you go back to sleep, but I want you comfortable. And they're really used to working with us on those things. And it's nice to have that kind of teamwork.
For sure. Somebody asked, I'm a Medicare plan G, is referral necessary for upper blepharoplasty? I'm not sure what Medicare plan G is, but I know that sometimes blepharoplasty is covered. It really depends on the insurance. It varies from insurer to insurer. So there's 20 different criteria. We just submit your stuff. That's great. So we see somebody that looks like they're a medical patient, we'll submit it. But if we don't think it is, we'll tell you that up front. And sometimes we have to find out. But in general, I'm not I don't know much about Medicare Plan G, what that means precisely. So
You could also just call our
Yeah,
office
they can
and
take-
our billing department would totally be able to help you sort through that. I wanted to address a couple more questions. If you can't do goggles, are frozen peas good to use? I love them. So frozen peas in a Ziploc bag that's lightweight and it molds to your eyes is a great option. So yes. Does surgery affect driving? No surgery for 2 days after surgery. If you're in pain, if you're on narcotic pain medicine, or if your vision is blurry. When in doubt, if you don't feel comfortable, don't drive yet. After 2 days, a lot of people, as long as their vision's okay, feel okay to drive. It just depends on you and the surgery that you had. And then how long is the typical surgery, Will?
I mean, if you're just doing a blepharoplasty on both sides, it's probably a half an hour or less, all the way towards some operations can be 3 hours, depending on if you're doing your lower lids or your brows, or again, it varies wildly from patient to patient, depending on what they need. And so typical is the funny word there. I'm not sure what that means precisely, but for a regular blepharoplasty, it was about half an hour of like surgery time. But of course, if you're having surgery at a surgery center, you got to get there an hour beforehand. You're gonna be around for at least half an hour afterwards. So I always tell patients, count on half a day. Don't try to plan some other appointment 2 hours after surgery. And so count on half a day as far as if that's what you're looking for as time blocks. So hope that answers that question.
Yeah, totally. If you're having surgery, don't plan to do anything else that day. It just adds to the stress. And I do feel like that when my patients feel relaxed, I mean, no one's going to be relaxed totally day of surgery. Everybody's nervous. That's normal. But to the extent that you can be relaxed and not stressed about other things, you'll have a better experience. You'll heal better. So don't plan other things. But in terms of how long it actually takes, Phil's right. I mean, like a straightforward upper eyelid blepharoplasty from start to finish can take us 20 minutes. But then if things are more complicated, somebody has a weak eyelid crease and I need to tweak that, or there's a lot of fat that needs to be sculpted, it just adds to the time. So it really depends. But yeah, so I hope that answers your question.
But just as an overarching thing, and what this leads to as far as how long is it, our goal when people come to see us is we kind of find out what you're looking to do. We really do try to offer or present the least invasive way we can achieve your endpoint. You know, I do surgery all the time. I love doing surgery, but I see lots of patients who that's not what they need, and we'll tell you that. And so you can come to see us confidently, know that we're going to steer in the right direction for what's best for you. You're not going to get a sales job. So I see one new message. Very end.
Initial consultation fee.
So our consult fee is $150. And so, like I said before, that's the fee for coming to say hi and talk to us. But if you decide to have surgery, then that goes towards whatever you would pay for the surgery. So it nets out to be zero if you have having surgery. So hopefully that's reasonable, and they can talk more to you about that on the phone when you schedule.
Well, awesome. Well, thank you both so much. I know I learned a lot always listening to you both, and thank you again, everyone, for joining us. Again, this will be recorded and put on our website and emailed to everybody who participated as well, so you can rewatch it if you missed anything. And like Dr. Bearden said, please feel free to call our office. We are happy to answer any additional questions that you have. If something comes up later on or you think of something else, we're happy to help.
What is that? What is the best number for them to call, Melissa?
Yeah, so their direct office is 287-2022, and that will also be included in the email I'll send out to everybody. So you'll have that.
All right.
Yeah.
Yeah, good job. Hey, I just want to say it's great to be here, and I'm very lucky to have an awesome partner who practices great medicine, and it's fun because we get to bounce ideas off of each other frequently. And this is just one example of that. What a fun lunch break. So thanks, Will.
For sure. We have a really good team for sure. Nicole's great.
Awesome.
Thank you guys for all coming today.
Yeah. Awesome. Thank you. Thanks, everybody.